Do we want to do this?
Yeah, we do, Brenda.
Hey everyone, we're your hosts. I'm Brenda Adhikari.
I'm Tom Johnson.
I'm Maggie Bartlett.
Hi, Tom and Maggie. How are
Sort of
you?
sounds like the top of 60 Minutes, the way we all.
I'm Brenda Adhikari. I'm Tom Johnson. Those stories and more tonight on Why Should I Trust You?
Yeah.
Sound pretty good, right, Tom?
Yeah, it sounds good.
Um, so look, today we're going to be speaking with Dr. John Ioannidis. Tom, he strikes me as somebody who's kind of a unicorn in this space. And tell us a little bit about him.
Yeah, he does seem like a unicorn. So he grew up in Greece. He did his medical residency here in the United States. And then he's gone on to become one of the most cited medical researchers. And he studies scientific studies, which I'm going to let Maggie unpack that one. But he's a professor of epidemiology at Stanford University. And he writes in his bio, my work aims to improve research methods and practices and to enhance approaches to integrating information and generating reliable evidence. Science, he writes, is the best thing that can happen to humans, but doing research is like swimming in an ocean at night. Science thrives in darkness.
That is poetic. I gotta say,
Yeah,
like,
it's
that's
deep.
some Shakespearean
I have
shit right
no
there.
idea what that means.
Yeah,
It hits me hard. I think
Oh, good.
it definitely speaks
go
to me as a
on.
researcher. Um, that you often are kind of dropped in the middle of the ocean and
Yeah.
have to swim back to shore to find the answers. And that's one of the beautiful things about science and research, and one of the things that really pulled me into it. And, I think one of the things that's interesting about John is he's not afraid to make waves during the pandemic and well before, even starting in 2005 with what was really a seminal research paper, why most published research findings are false. And that kind of changed the entire landscape, not only in, his field, which has kind of been coined meta science, but all the way down to me in virology. And I think his ability to advocate for rigor and transparency really spoke to the broad public and scientists alike. But during the pandemic, he was often critiqued for overhyping his interpretations. And we really appreciated him advocating for measured approaches, but we felt like really just this underestimation of the virus's potential impact in the early days was more damaging than helpful because people were dying and we needed an all hands on approach. And of course, no one person has the answers and no one person in science should, but we need people like John, epidemiologists, we need virologists who are figuring out how the virus works, and we need policymakers to all come to the table and figure out what we need to do. And it's those different perspectives that ended up becoming key, but often we're at odds.
Right. Maggie, I really hope we get to talk to him about some of this stuff that you just mentioned. Because, like you said, early on in the pandemic, he was very critical of lockdowns. By some measures, some folks had said that he thought that the response was an overreaction. But and like you also said, he got criticized heavily by folks in establishment science, mainstream science, whatever. But look, while he believed all that, he also believes in vaccines and that treatments like ivermectin and hydroxychloroquine are not proven to treat or cure COVID. Vaccines don't cause autism, and he took a lot of heat from folks in the medical, those who mistrust the medical establishment for those viewpoints. So, look, I think he's clearly a very interesting, complex figure at a time when things are often forced into these like simple black and white binaries. So, I'm really excited to talk to him.
Absolutely.
Welcome to our show, Dr. John Ioannidis. Welcome to Why Should I Trust You, which is our new podcast.
Thank you for the very kind invitation. Very happy to join you.
Yes, absolutely. So, our show is looking specifically at why trust in public health, in mainstream science, in establishment science, medicine, whatever you want to call it, has broken down to such a staggering level. And I've often heard this phrase dissident science versus mainstream science. What does that mean to you when you hear that? What does dissident science versus mainstream science even mean?
I think it means different things to different people. I'm not sure that we can define science as mainstream and dissident. Science is an evolving frontier. It is full of surprises, full of reversals, full of evidence and lack of evidence very often that we try to fill in the gaps. And not everybody will agree on what evidence we need, what evidence we have, what that evidence means, let alone how it should be translated into public health actions or guidelines or recommendations and what people should do. So science is not something that is cut in stone. It is a living organism. It is evolving. We need to show respect in positions that may not be the ones that we endorse or we believe or we feel are more likely. And I think that in that perspective, there's less room for that breakdown into mainstream and dissident. I think it's all part of one organization. At least this is the way that I want to see it.
Yeah, you've been called both. And I had introduced you in this episode as a bit of a unicorn in science because you're somebody that folks who they feel abandoned by public health or mistrustful of them, um, stuff that you've said has really resonated with them, but you also hold respect from people who have been in this. Again, I go back to that dichotomy of mainstream science. And what do you make of that, that you have fans and detractors everywhere?
Having fans is problematic. It probably means that you need to be very careful with what you say because people should not necessarily be excited about science. They should be thoughtful about science and skeptical and critically thinking about science. Now, having people who disagree with you, this is wonderful. And these people I see as my benefactors, especially when they have solid arguments and evidence and better evidence than the evidence that I can put forth. I think that we should keep an open mind that what we have found and what our studies might suggest sometimes may be wrong. Very often it might be wrong. Or maybe it's not completely wrong, but it can be improved. So having people who disagree is wonderful, provided that the disagreement remains within a sphere of respect and dignity for the people involved. The science is perfectly fine to completely decimate and attack with arguments and better data and just conclude that this is horribly biased and it's full of mistakes and full of errors. And thank you very much for identifying these mistakes and errors and biases. We can do better. We'll try to do better next time.
It seems like we've moved into an era, we are moving quickly into an era where a lot of people are breaking away from sort of the traditional mainstream sources of truth when it comes to science, and they're researching, in quotes, things for themselves. They are becoming perhaps better informed, and I don't think anybody would think that's a bad thing. That's a good thing. But they're turning instead to sources of information on the internet, social media, podcasters, sort of infotainment. Um, and they're often dismissing, science that doesn't support their political viewpoint, their cultural viewpoint, doesn't sort of align with sort of how they felt during the pandemic, whether public health was overreacting or was reacting the right way. Um, it, how do you feel about where we are right now?
I think that we're in a horrible set of circumstances, and I think that unfortunately it is getting worse. It's a global phenomenon. It's not just limited to what we see in the United States, although we have probably one of the worst levels of toxicity, polarization, and the wrong recipe for communicating science and for understanding science, for winning trust of the average person in the community. So why did we get there? I think it's multiple factors, and I think that it's not one person or one side to blame. I think that we are flooding in information that may not be reliable. I don't like the terms misinformation and disinformation because they have been so used and misused that they have lost their meaning. It's a very easy way to say this is misinformation, this is disinformation. So we discard it and just forget about it. This just makes that mis or disinformation even more attractive to many people. The fact that it is summarily kind of discarded without scientific argumentation and without evidence. We have lots of people who are not happy. They're not happy with what our world is offering them. They feel marginalized. They feel that they do not belong in, you use the term mainstream in the beginning, that the mainstream is even against them, that they need to fight against that mainstream, against that power that is shaping their lives in ways that they do not want their lives to be shaped. So it's a very delicate situation, even if science in principle is well-intentioned when it comes to translating its results, like in public health, we need to translate results to act. Many people will be very skeptical, will be negative towards what we have to offer. They might see that science is siding with some of the powerful entities in government, in big pharma, in big tech, in big food, in big anything. It is not just their fantasy. Science does take sides very often with these very powerful structures. Sometimes they are bedfellows in ways that are inappropriate. There's clearly very strong conflicts of interest at play. Very often, science is not just done by philosophers who are aristocrats of knowledge and spend their own money in generating evidence. It's done with funding to a large extent with taxpayer funding, which adds an extra layer of skepticism to many people that these people are wasting my money and are making my life more difficult. And also with lots of funding and support from other entities that also want to make money. So this means that they will do their best to design, contact, analyze, publish, disseminate results that are in their favor, in favor of their agendas, of what they want to sell, of what they want to promote, of how they want to sell. So it is a real problem. And I think that on the side of science, we need to do our best to protect independent science, science that is not conflicted, science that is rigorous, that is really aiming for the best of the community when it comes to translation and recommendations, and is open to be wrong at times. And this is exactly how we make progress. We try, we fail, we try again. Sometimes we try hundreds of times before we fail. And we need to be honest about our failure rate and our ability to get there sooner or later, hopefully, but not oversell what we do. And obviously not give a picture that we are conflicted in what we do. This is a horrible recipe to gain trust.
You look at something like vaccines and autism, something that feels like it's been settled, something that, arguably has been studied more than, I mean, I'm not a scientist, but from what I hear, it's been rigorously studied. The entire childhood population of Denmark was studied. It's back up for consideration for a huge part of this population. It's leading to decreasing vaccination rates in this country. As we saw, 2023, there were 4 measles outbreaks. Last year, there were 16. What even the term settled science is, I think, coming across as elitist. It's coming across as an us versus them. Well, why is it settled? It's settled because Big Pharma paid you. How do you make the case for those unconflicted examples of science?
I think that transparency matters and communication in a way that you show what is the evidence and not try to attack people. Clearly, we have a major problem with vaccine hesitancy. Indeed, there's lots of people who believe that standard vaccinations that have saved so many lives and hopefully will continue to save lives in the future need to be abandoned or they feel that they cause tremendous harm like autism or other consequences. Um, it's not easy to respond to that. I think that we need to show that this is evidence that is not conflicted, number one, that it's not that someone paid to get these results, although we have to admit that there's other research that is paid to get that, whatever the sponsor wants to get, and try to separate the two. We need to show that we are very meticulous. We take every concern very seriously. We can show data that disprove the claims for major harms like autism, rather than say that the people who complain are idiots or they're antisocial personalities or just trash them in social media and media. Some of these people may be very well trained. They may have PhDs and they may have trained in top universities. They may be very smart people with high IQs otherwise, and they may be wonderful citizens in other ways. So they're wrong as far as that aspect is concerned. I'm wrong in many aspects of my views that I express every day. Who knows how big a percentage of what I say is completely false. It doesn't work to just marginalize and separate them. It's them and us. And I think that we just need to stick to the evidence without insulting people and just try to say, this is what we know. This is a topic that we have studied very extensively with studies that don't seem to be biased. They don't have conflicts. And of course, yes, maybe the sun will not rise tomorrow, but that's a possibility. But that's not really very likely, as opposed to other things that are possibly likely to be reversed or to have suboptimal knowledge or maybe lots of room for improving our knowledge base. I think that very often we have tried to package solid knowledge like vaccines do not cause autism with other knowledge that is more tenuous, like every kid needs to be vaccinated with COVID-19 and get boosters every year. I mean, that's not the same level of documentation as compared to MMR does not cause autism. And if we try to package too much, especially under toxic circumstances, lots of people will fight back and they will have many items that we will be wrong to push and they will be right. And once they're proven right or it's questioned whether they're right and we are wrong, then that opens completely new avenues even to challenge things that are very standard and very well established, as you say, settled. Is the sun rising every day settled? I'm not sure that's the right
For
word,
now.
but it's of that magnitude. Yes.
John, I think it's so fascinating. I remember when your article on why most published research findings are false came out and how that kind of shook through the research world and how we address things. And I wonder if you might talk a little bit about what is statistics and how we use that in terms of these big clinical trials that we're using to distill and package down complex ideas about the outcome of these studies to the public.
So basically, much of my research and also the research of other people who are studying biases and credibility issues and reliability and reproducibility and transparency in science boils down to trying to understand how likely is it that different research findings might be true or false. And of course, that has repercussions on how they would be translated. So we use complex methods that try to make inferences out of data. Some of our studies are very carefully designed, others are more opportunistic. Some depend on data that are observational and may have been collected for other purposes. There's quite a big spectrum of the starting point where we start from. And then we have to say when we reach some research finding, whether we believe it or not. And it's very often a common misunderstanding that if you use some statistical testing and you pass some threshold of statistical significance, this is good enough. You have some solid evidence. That's not the case. In many circumstances, having a statistically significant finding might mean that it's 1% likely that what you have found is true. In some other cases, maybe 99%. And there's different factors that shape that gradient. So it depends on what is the circumstantial background that you do the research. Are you shooting for something that is extravagant, very, very weird, that we have no other prior evidence to support it? Or are you studying a very simple question that has been answered again and again, like tobacco is killing people, is causing lung cancer? How big are the studies that we do? How biased they are? How much interest there is in getting one type of result? And here is where conflicts of interest come into play, because they may affect the design of the study, the conduct, the analysis, the reporting in many ways that interact with each other. And also how many scientists are trying to make discoveries in a specific field. Because if you have only one shot, it makes a difference versus if you have 50 shots at the same question. And it also makes a difference if you have 50 shots where everyone is coordinated and are trying to put their data together and are using some consistent rules, and they have agreed ahead of time on how the question will be asked and how the data will be synthesized at the end of the day, versus each of the 50 teams being on their own and each of them trying to outpace the others, not combining their evidence base, but just trying to come up with the most extreme result that would beat their opponents. And you end up with what we call the winner's curse in that situation. So it's a very complex environment. Much of that is happening outside the remit of what the average citizen will see. I think that the average person in the community usually will see fragments of that evolving conundrum. And most of the fragments that reach to the general public are further selected to be extreme or to be extravagant, or they're presented in an extravagant way. So much of what we communicate, the vision that one gets in the community of science is a distorted vision. It's not really very nice. It's better than astrology, but it's not what I think most scientists and most people in the community would like to have as a vision of science that is being shared with them.
Yeah, I just want to take you back in time to the beginning of the pandemic, and you wrote a famous piece with the headline, "A Fiasco in the Making, question mark. As the coronavirus pandemic takes hold, are we making decisions without reliable data?" And this was back in March of 2020, which for I think most of America was really the kickoff of this pandemic. And in the piece, you're calling for or making a plea for better data. We just didn't have the testing. And I think the way you saw it was that the country was racing into mitigation efforts like the lockdowns and shutting schools and shutting businesses. And you were making an argument that perhaps that was fine temporarily, but what we really needed was testing to understand how deadly this virus was. And your piece landed at a time where, cities like New York were overrun and inundated. ERs were just there was just havoc with people dying from the virus. So there was quite a fallout from your piece. And I'm wondering, 5 years on, if you could reflect on the fallout that you experienced from that piece. And then on the other side, just talk about how much of the lost trust that we're experiencing now do you think came from public health overreacting without enough knowledge about how deadly this virus was going to be?
I have to go back 5 years, and that's a very painful time indeed for everyone. And the fallout from that piece was horrible, and also the fallout from several other papers that I wrote and published in the peer-reviewed literature. I published about 100 peer-reviewed papers on COVID-19 over these 5 years. They reinforced some of that fallout in various nasty and harmful ways. Uh, Beyond the personal cost of getting death threats and feeling that your physical presence on this planet, and not only yours but also all the family members, is being threatened. I think the cost to the community and to public health. And I'm not saying this to blame anyone, because I think this is a communal failure of all of us. We didn't manage to respond in a way that would be thoughtful and organized and aiming for the maximal benefit of everyone. There was very strong partisanship. There was polarization. There was an effort to try to prove I'm wrong, you're wrong, I'm right, you're wrong, which is not really the way that you want to go when you face a problem that is affecting the entire community. It's not just one side suffering, it's everyone suffering, or everyone having the potential to suffer. I think that creating enemies within the people was the wrong recipe. Saying that we have some citizens who are the good citizens and others who are the bad citizens, some who are pro-science and others who are against science, some who are knowledgeable and others who are pariahs, and that's not the way to respond in a public health crisis. You cannot aim to save 50% of the population or 60% of the population. You need to be able to help everyone, and you need to help even more those who disagree with you. You need to convince them about what needs to be done and whether they could contribute to a common effort. And I don't think that we managed to do this. Could we have done better? I mean, obviously, we could have done better. If you look at excess deaths during the entire pandemic, we've published analysis in PNAS looking at the 34 countries that have reliable death registration data. And the US is the worst practically, along with Bulgaria. In people less than 65, we're absolutely the worst. Who is the best? The best is Sweden. Sweden had 3.5% less deaths during the pandemic years compared to the pre-pandemic, once you account for the age structure change over the years, along with New Zealand, pretty much the same. Two very different recipes. Sweden completely opposite to what the US and other countries did. New Zealand,
It like closed its
again,
borders.
a country that closed its borders, and it did very well, because eventually it was hit only in the Omicron phase, more or less, which was a variant that had much lower fatality rate, and we had vaccination by that time. Everybody had been vaccinated. So I don't think that the US could have been New Zealand, to be honest. And I don't think that the vast majority of countries could have been New Zealand. But I think they could have been Sweden. Now, the question is, could they have been Sweden, really? Not for the virus, but for everything else that makes Sweden a society, a health system, a cohesive society, as compared to the US, which has so many marginalized people without health insurance, without good health care access, with ongoing epidemics of obesity, of overdose, of metabolic syndrome, lots of people who are very poor, who are marginalized, who are distrustful of public health and of again, medicine in large scale, and who really were the major victims of the pandemic. So the people who we had neglected over decades, I think, were the ones who were affected the most. We have evidence that is stratified by education and socioeconomic status, and it is devastating. The differences are devastating. We thought that physicians would be the ones who would be decimated and our health systems will collapse. When you look at death rates in physicians in the US are very close to what they were pre-pandemic. When you look at excess deaths of physicians in Canada or Finland or countries that did even better, they were even fewer in the pandemic years compared to the pre-pandemic years.
But for
So,
healthcare
so
workers, was that different?
same for healthcare workers. What mattered the most was whether we had a society that was healthy before the pandemic hit, whether we had a health system that was healthy before the pandemic hit, whether we had treated and cured our inequities and inequalities within the social fabric, whether we had good access to healthcare, whether we had hospitals that were functional, not just for the elite and for rich people, but for the average citizen. And of course, Sweden had all of that. We had none of that. We had, many, many major problems. In a way, we lost all these lives even before the pandemic started. When it started, we were doomed unless we were able to work on curing these problems. And also to cure these problems, we had to gain trust for the vast majority of the population, which we didn't. So we just went completely the wrong way,
Yeah.
and we lost even more trust.
But we came limping into the pandemic, blindfolded, unhealthy, with unequal access to healthcare. We got ravaged. There was a urgent emergency triage effort, again, without knowledge of exactly how deadly this was, how widespread it was, because our testing collapsed right out of the gate. Is it your belief then that, as you said, we were kind of screwed at the get-go? Did our mitigation efforts just make things worse, or were our mitigation efforts the best we could do based on the fact we were limping into this?
I think it's very likely that our mitigation efforts made things worse because at one level they made us lose trust from a big segment of the population that would not follow even when we had some things to offer, like vaccines. Instead of managing to vaccinate almost everyone who would be highly vulnerable, we were kind of into warfare, or whether there should be mandates, whether we should penalize and kick out of employment people who did not want to get vaccinated, whether we should paint a picture that people who didn't want to vaccinate their kids were idiots and antisocial elements. So we lost a lot of trust in that way. And we had already lost trust with all the restrictive measures of lockdown and school closures, with devastating effects on education, with devastating effects on mental health, with making inequalities even worse. So all these lockdown variants practically protected mostly people who were well off and people who were less vulnerable compared to the vulnerable. Many people who were vulnerable continue to work and be even more exposed on average. And the really vulnerable were not protected at all. Nursing home facilities were devastated. They were like a time bomb even before the pandemic, with cuts and privatization and staff that would just widely infect residents, underpaid,
Is that testing again, though,
facilities.
John? Is that
Sorry?
testing? Is testing the root of why we messed up the nursing home and made that population so vulnerable?
I think that it's hard to say because it's not just one thing that went wrong. Very early in the pandemic, I was very much in favor of testing, both at the level of getting epidemiological insights about how widespread the virus is and what the fatality rate is and what is the risk gradient in different ages and in different subsets of the population, but also to try to use testing to avoid the infection spreading uncontrolled. I'm not sure I was correct about that second component. That if we had massively tested, we would have avoided that. It might have helped, if we had started early on. But really, we had all these other dysfunctions that we did nothing about, and we just made things worse. We just added problems to an existing crisis. It was like having someone who is already sick, and instead of trying to take good care of that person, we start, kicking him and slapping him in the face and
Well,
telling him you're
let
an
me
idiot to be sick.
Yeah, let me push on that for a little bit because sometimes when I hear that, it seems like we're trying to have things both ways, right? Because on the one hand, you know, we're saying that the mitigation efforts may have made things worse. But on the other hand, we're also saying that this is a country that is suffering from chronic illness and is so sick,
Mhm.
70% obesity rate. I mean, comorbidities, America, we are just one big comorbidity. So
Yeah.
how can both things be right, John? How can mitigation measures be excessive in a country where autoimmune and chronic illness is so severe that don't we have to take precautions to protect that population?
Yes and no. I mean, you have to take precautions to protect even more so those who are at higher risk. Uh, but this doesn't mean that it should be a blanket sort of protection for everyone at the same level.
So you felt like
And
it was too one size fits all, that there should have been a
yes,
much more customized approach based on vulnerability.
But you're
in
not,
fact, probably it was even worse for those who needed more protection. On average, in many settings, they got less protection than the average person. So, uh, we protected people who required very little protection, or perhaps even no protection. Some might argue they can tell on their own that they should try to avoid exposure beyond a certain level that would make their life acceptable. And we just didn't do almost anything that would really protect those who were the most vulnerable. Now, where is exactly the cutoff is very hard to tell.
Yeah.
And I think that there should be an element of shared decision making. Some people might argue, well, everyone needed to be very strictly protected. I don't buy this. The risks were very, very low for a large segment of the population, even in the United States. And this is a segment of the population largely that would keep the society alive and would keep it functional and would allow for children to go to school and would allow for mental health problems not to rise the way that they did. Um, so I think that we failed to protect those who needed more protection. And we just threw the entire community, the entire society into a very chaotic, suppressive situation that we're still seeing the consequences even now, so many years after this.
but you didn't sign the Great Barrington Declaration. And just for people who are wondering what that was or trying to jog their memories, that was a declaration that said, hey, we should protect the vulnerable, but let the non-vulnerable, the younger population, sort of resume normal life and let the virus take its natural course. We'll build up herd immunity, and just sort of let the chips fall. Again, while protecting this elderly, or unhealthy population. Did you support that? I know you're not into signing declarations like that, and that's an interesting take, but did you support the concept of that?
So let me explain why I did not sign first the Great
Mm.
Barrington Declaration or the John Snow Memorandum that was against the Great Barrington Declaration or any declaration, memorandum, open letter, petition, plea, whatever during the pandemic. Even before the pandemic, I had published a paper that argued that collection of signatures is not a way to promote science. That happened in one special circumstance where about 800 scientists, wonderful colleagues, signed a petition to abandon statistical significance. And they had a comment in Nature with 800 plus signatures. We had a survey of these people, and we realized that many of them had not even read what they had signed. Many of them seemed to disagree actually with what they had signed. Almost everyone was not following what they had signed when it came to their own work that they were publishing, and there were major misconceptions. So I published that paper before the pandemic, arguing that this is not the way to do science. And during the pandemic, I published another paper where I argued that in a crisis situation, it's even worse because science is not decided by vote counting. It's not that if you have more votes on one side, you're right. There's an issue of coercion. If top people sign, then their fellows and team members and younger faculty may feel coerced that they need to sign. It's impossible to summarize science in an open letter or a petition. Science has nuance, details matter, how to, implementation. Science also can change. I don't want to sign away my name and then evidence comes that proves that I was wrong and I need to modify my positions in minor or major ways or completely dismantle what I thought in advance. And also, this signature collection leads to polarization, toxicity, further partisanship, crash, kind of warfare. And this is indeed what happened. It became a very polarized, toxic situation with different clans fighting each other. Both sides had wonderful scientists. I published another analysis in BMJ where I looked at the citation credentials of the top signatories of Great Barrington versus the John Snow Memorandum. They both had amazing signatories. The one difference was that the John Snow Memorandum had more influencers. And I think that this is why they were winning at that time. Downstream, Great Barrington people acquired also great influencers. And I think
Yeah,
that
and I
this is
think my
why
understanding is they
some of your
also had
colleagues.
like some false names and things which they actually admitted to at some point. So you're right. I think that both sides had uh they could each make the case that they had street cred, you know. And I'm curious just to go back on that. You know, now you've got several signatories who are about to assume the top job in Washington,
Of the Great
D.C.
Barrington Declaration.
of the Great Barrington Declaration from Jay Bhattacharya. I believe Marty McCary was a signatory. Or look, and I don't want to overemphasize the Great Barrington here. I think folks that who were critical of the COVID response as far as mitigation measures, who in general feel as though they may be put into this category of dissident scientists. You know, Jay Bhattacharya, Marty McCary. You know, Dr. Oz, and of course, Robert F. Kennedy Jr. Do you, in your estimation, you know, think that those that we're about to just go through a great switch as far as trust? Or is there something to be said for, you know, a status quo disruption, and that whatever you feel about, you know, certain issues that are visceral in this country for good reason, vaccine, water, food, that a status quo needs to be disrupted. And I guess my question would be, like, is there a place where, you know, the country can kind of agree around this group, or is it just an even more polarizing next step that is going to drive us further?
I cannot predict the future, but I am worried about the future, and I'm worried about the past. I'm worried about the present. I'm worried
You're
about
just
the
a
future.
worried guy.
Well, I'm
Me
I'm
too, John.
I'm very skeptical and perhaps self-defeating in that regard, because I'm not the type of person who will celebrate that. Oh yes, we have easy solutions. We don't have easy solutions. We have lots of things that can go wrong. For example. One easy way to go wrong is when you have a change or reversal in power to aim for some sort of retaliation or revenge or, you know, getting back what was taken away from me. You know, if we go down that path, it will just be horrible. And, you know, some of the people who were probably improperly attacked, if they decide to just attack others now that they have more power, that would be a complete disaster for trust, for the ability to move forward, for science, for serving the community. There's lots of things that are wrong. There's no doubt there's lots of things that are wrong. And I don't see that as a political statement. I think that I have tried throughout my life to see science as independent and fiercely fight for the independence of science from politics as much as independence from other types of conflicts. I'm not going to take sides that are kind of colored with one party or another. During the pandemic, sometimes I was attacked by right side parties and other times by left side parties in different countries on the very same issue, depending on what parties in different countries may have endorsed. And I'm not willing to go down that path. I hope that whoever is in power really goes beyond politics and defends the independence and the integrity of science. And I have good hope that this can happen now, anytime. I mean, it's always a good opportunity. I do worry that there are statements in the background of some nominees that really leave a lot of questions open about, well, will there be an attack on standard knowledge on vaccines? Will there be an attack on some, you want to use the term settled, or things that are very close to the sun is rising every morning? Yes, we could have that recipe. And if we have that, that would also be a
So
disaster.
I
But
guess,
there's also lots of things that are wrong that could be fixed. So if we focus on things that are wrong, like how do we improve transparency in conflicts of interest? How do we safeguard the independence of science? How we decrease polarization and partisanship when it comes to scientific matters? How do we aim for public health response that is more uniting rather than splitting society into fragments? How do we try to take care of people who are vulnerable? How do we deal with the obesity epidemic, with metabolic syndrome pandemic, with overdose, with inequalities within our society? How do we improve access to care? How do we take care of people who are vulnerable in their everyday life in many ways? So there's so many things to fix. And I think it would be completely stupid, uh, both for those who are in power and for those who are criticizing, if we forget about common targets that we can easily, well, at least readily and forcefully try to fix, and just focus on what divides different clans, and just try to get the upper hand in a clan fight of sorts.
I love how you outlined, how complex this issue is. And I wonder if you could maybe just hit like three things that could unify this really divided population, especially whether that's surveillance or, I'm scared about avian influenza and that coming on the heels of everything, and have we learned those lessons? So are there three things that you think would unify people? And what are
I,
those?
I mentioned more than three, so
Yeah, yeah.
I would probably need to cut back. But I think that everybody would agree on the need for transparency and diminishing conflicts of interest. For example, when it comes to regulatory agencies like FDA, there has been a long-standing concern that we have a revolving doors situation. FDA depends on big pharma, and many of its officers eventually move into big pharma. The processes very often allow the sponsors to have the upper hand in deliberations, all the way from designing an agenda for some licensing package all the way to getting it through. I think we can improve on that. We can show that we have regulatory agencies that are really independent. They're very transparent. They're very thorough. This doesn't mean that we should just demonize big pharma. No, we
Right.
need industry. We need enterprise to develop new medications, new biologics, new vaccines. But I think that there's a lot of room for safeguarding the independence of the research agenda in a way that we can convince more people who are currently not convinced. We can tell them that look at this. This was on an arm's length or more from potential influence, and also the way that the studies were run and the people who run them, and how they were designed. They were not within the remit of the sponsor. So you can have more trust on what we get here. This might also mean that we may need to move forward with removing more interventions that are ineffective, and we can show that we're really very serious in offering a strong endorsement of both effectiveness and safety, lack of harms when we have something in the market. If you look at the scientific peer-reviewed literature, the mainstream scientific literature, a very large number of medical interventions are not effective, even though we thought they might be. They're out there, they're used, they're misused, they cost billions of dollars. Sometimes you only get some harms that they may have with no benefit. So if we show that we're willing to start cutting back on them, and at the same time make a case that, look at this, we keep interventions that are very effective, like MMR is amazingly
like
effective
MMR.
and safe, but we are working on getting rid of others that are not. I think that will give a signal that may boost trust.
I think I
This
think that's such a great point. And right now, sometimes I think that because people like to put things in black and white, there's appears to be this chronic disease versus infectious disease like battle happening. I know that there was something that RFK Jr. said in 2023, which is to, have infectious disease take a break. Or like funding for it to take a break. And the truth is, I hope that, and I imagine we all do, that it doesn't have to be an either or, and that in fact that they're very much related to each other, and that in the event of a bird flu, in the event of another major threat in this country, how one's health is going into it is actually going to determine one's health potentially coming out of it. Now, that said, I do want to make a point, having lived in New York City through the worst of the pandemic. John, I saw healthy people get ill and I saw young people get sick, and I know the majority was not that, but I do just want to point out, 1,200 kids did die during COVID. There were young people, there were people without any sort of comorbidities, and it was a significant amount. But you're right, it wasn't by any stretch of the imagination the main group. But I'm also hopeful that these kind of silly binaries that I think media conversations and quite frankly, some of the politicians, because they're kind of fun to say, chronic disease versus infectious disease, it's just so silly. It just doesn't help things.
I think that you're right. There's no black and white in most public health issues, and it's not that risk is zero for almost anything. Even walking out of your house, you may have a tree falling on you, and you might die. I mean, it's all probabilities. But I think that there's probably more way for more shared decision making rather than mandates, rather than forcing decisions on a population on many aspects. I think that most of the mandates recipe during the pandemic made things worse. When we say that the risk gradient, for example, is very sharp, and kids and young adults, especially healthy ones, have very minimal risk, this doesn't mean that it is zero. And I think that we could envision a situation where we could have kept schools open, but if some parents didn't want their kid to go to school, we should have the option of having some Zoom for them. There would be teachers who would have problems and would decide or would even recommend that they should only try to teach remotely for a while. But having flexibility rather than having a blanket approach would be best. And at the end of the day, if we try to push for minor things, relatively minor things, we will lose the major ones. And this is what I have to worry. Every single death for me is a tragedy. I want to avoid it. I'm a physician. Every hospitalization, I want to avoid it. Every harm to any individual, this is what I'm trying to avoid. But if we say that children died of COVID-19, if you look at the global available data for deaths in children, we had death deficit around the globe during the pandemic years in children, and also in adolescents, and also young adults up to age about 20, 25. It means on average, fewer people died in these age groups during the pandemic years compared to the pre-pandemic years. That was not a virus that really targeted these people. Some died. Every year, people died. They died of influenza. They died of all sorts of respiratory viruses. Many very young, neonates and infants die. It's all a tragedy. And if we can do better, and if we can convince more people to use effective measures, that's amazing. But if we try to push for mandates for things that are more tenuous and have more minimal or questionable benefits or risk benefits, then we will lose the big picture and we will start people really fighting against science, fighting against public health. We do see that happening. They want to get revenge against public health. This is horrible. I'm intimidated at that wave of anger and revenge seeking that we see at the moment.
Yeah.
I
No, I agree. And
I'm
look,
really troubled.
yeah, I think that's right. And look, as far as schools go, I mean, as a mom, that was oof, that was a very difficult time. And again, being in New York, it was just such a mixed bag of emotions. And as far as the death rate, and look, I'm not an epidemiologist or a virologist, and I don't claim to have that, but it's sort of like a new cause of death. You know what I mean? And like whenever there's a new cause of death anywhere, I think it's just no matter what the number is, you just pay attention, right? But I do, it was like a year before people weren't dying of COVID, and a year later, there's one additional thing that they're dying of, you know? So I just wanted to make that point. But look, I just wanted to say that this was a phenomenal freaking conversation. And
Thank you so much. I really enjoyed talking with you as well.
I just want to thank you so much for joining us. And to our viewers, to our listeners, we hope you enjoyed the show. Please drop us a comment, a like, a subscribe, a rate, a review, all of those things. Please write to questions@whyshoulditrustyou.net. And we'll see you next time. Thank you so much.